Sorry, can I just ask really quickly, are we, in terms of judging on the portfolio, are we looking at videography, reporting, producing, or all of the above?
All of it. Let me just go back to the guidelines.
And do you guys, from looking at these four right here, remember which one you guys haven't seen yet?
Yeah, we haven't seen the Great Resignation one. So the guidelines say a portfolio is 4, no more, no less, stories on any topic by the same individual or the same team judged as a whole. News organizations are limited to 1 team portfolio and 1 visual presentation portfolio. There is no limit to the number of individuals from the same news organization that may enter portfolios. So we only have 1 portfolio in this category. Unfortunately, the others who entered, I think they were mostly disqualified for time because some of the pieces in their portfolio were over 10 minutes. And I think at least one of them entered something of a different format, so an interactive along with videos. So we have 1 to consider in the video individual category.
Okay, got it.
And Marcel, since it's individual, this person has both produced and edited. I'm just wondering how heavily we should be, like how we should be thinking about editing.
Yeah, so this person should have produced, shot, and edited 90% of it. So, as we said before, there may be some extra video that someone else shot, but it's like a single byline story.
Thank you.
Mm-hmm.
If you walk down any sidewalk, you will see now hiring. If you drive down any road in this area, you will see now hiring. We had 42 employees before the pandemic. After the pandemic, we had about 15 when we opened back up. We have about 22 employees now.
I got you a drink.
Oh, is it now?
Yeah, it's right.
Thank
Right
you.
here. You're welcome. You got it?
You was there and I didn't even see you.
There you go.
Okay.
A lot of our people moved. Some of our people retired. And then some of them we don't know.
And then can I also get the turkey gravy on that, please?
Yes, ma'am.
So that's what you do. You take a whole bunch of towels, or you can use your trash bags. All right, come on in. So last year was my first time sitting down for a good little 6 months without no work. It felt good, you know what I mean? The unemployment actually did help a lot last year. It actually helped me catch up on bills. But then when Governor Kemp stopped it, it was just pretty much like, now I gotta go back to a job. Can you put in a work order in your phone? Tell him the floor looks horrible and it needs to be shampooed. I think he's off today, so he'll be here tomorrow. We're understaffed now. We only have probably like 4 or 5 housekeepers. And sometimes we have a whole house and we have 80 rooms. So if those 80 rooms sell out and 70 of those people decide to leave, we have a lot to do. So I still think that a lot of people are not coming back to work because they're scared. Cases are still rising.
Like,
if you want me to risk my life, also give me more money.
Like, y'all want everybody to get back to work. Y'all forcing people to go back to work.
For $7.25. That's how much our
$7.25
minimum wage is in
for
Georgia.
$9 for just $7.25, $8.50, $7.75. That's not enough.
Not no money.
I promise you, everybody in the state of Georgia will go running back to their jobs. Oh, the job is paying $15 an hour. Okay, cool. I'm running back. I need the money. But now people are looking like, well, y'all still paying the same. I'm still making the same thing, and I'm still behind on my bills. There's no reason for me to work. I might as well just sit at home and work it out with my kids rather than to get up every day and go to a job that's not paying me nothing and is not supporting my family.
Can you dust the TVs? Look a little dusty. And wipe the black around it too. It's a little, got fingerprints and stuff.
We're finding it difficult, especially for skilled labor to come. We had one staff who used to do housekeeping during the pandemic, and then she came back, but then Target offered $15 an hour, and we were at around $10, so we couldn't compete with that.
All right, don't forget to sweep really good and mop really good.
Yes, ma'am. I can see myself.
Sunday was so packed. Sunday. You open it Monday through Sunday. You got the gold dues too? You got these two? You do?
Well, when we knew that the barbershop was closing, the guy from the news came first. And he talked to me right out in the parking lot. He said, you guys are closing. I said, seriously? He said, yeah. You closing? I said, man, like, what we gonna do? This is how I feed my family. This is how I take care of myself. This is my livelihood.
We were closed for up to 8 to 9 weeks. Everyone tries to not talk about it, but this pandemic has put more on our health and wellness than anyone could even imagine.
I'm a stylist though, so I ain't a barber. I'm a stylist. Oh yeah, stylist. I'm a stylist. Caliber stylist.
You know, my mom and dad instilled in us to always make a way, especially out of no way. I cut hair in my yard for like 2.5 months before I came back to work.
Some people, it's cheaper for them to stay home. Sometimes it costs them more money for child care. It costs more money for health insurance, where it doesn't even balance out.
That's okay, let's cut it off. Let's try to even it out.
A couple of guys, me included, decided not to come back when we first opened. Because, like I said, we had got comfortable. I'm at home. I can put on what I want to put on, wear what I want to wear, listen to the music I want to listen to.
I was trying as much as possible to my my strongest ability to try to bring them back. I took them out, try to feed them, try to convince them. I tried everything I can.
You want kids, right? You gotta support your kids, right?
Everybody came back to the shop except me. I was the last one to come back. Then when I came back, we was fully staffed again. It was the camaraderie, missing the guys, and missing the barbershop atmosphere, missing the feel.
See you later. All right.
See you later.
Appreciate it. Have a good night. All right.
JJ's, we do restaurant, we do bar, we do entertainment, we do catering, we do decorations. We have the venue for like pretty much everything. It's been really stressful, and I'm not gonna lie.
You know, when the pandemic first hit, nobody knew what was going on, or, you know, the potential of if you're gonna get sick or if you're not gonna get sick. It definitely have opened my mind up to, you know, go back to school and further my education and expand out to see more what's out there. Not saying I'm leaving this job, but just to see, you know, what might be out there, you know.
I had to do pay raise. You know, I'm not a franchise, so I cannot afford to be given, you know, $14, $50 an hour.
Give it to me. Give it to me. Give it to me what you say. Give it to me what you say. Give it to me.
I mean, I got people that put on applications. Some of them, you know, they come, they might try a day or two, and they say that is not for them. Some of them will try to do part-time here and another part-time, and then they have come back and tell me that it's too much. They're overwhelmed with work, even though they're younger people. So I used to get frustrated at the beginning, and right now I'm like, okay, I just got to do what I need to do with what I have, and hopefully it'll get better. It's always been like the nature of Americans, to work, to make your money, and find a way to better yourself.
Courtney and Jenna, if you want to step away, we'll ping you when we're ready to talk about these. But if you want to watch these again to refresh, that's fine too.
You have questions?
What side effects should I expect with the vaccine virus?
First of all, you know the vaccine doesn't have the virus in it. Did you know that?
No, not really. I don't hardly know anything about it.
When the vaccine gets in your body, it has to ramp your body up and prepare it to protect you. And so that's what was going on. The side effects of the vaccine are different for different people. I've been engaging in community conversations for a long time, but when the pandemic started, all of those conversations shifted to coronavirus, the pandemic, and now we're almost exclusively focused on talking about the vaccine. Yeah, so I definitely would encourage you to get the vaccine.
You're
gonna get it, yeah. I haven't found too many people that don't want to get it, so that's good. So I think helping people understand the science, how the process works normally, even pre-pandemic, I think gives people some comfort and reassurance. So these are all words that are spoken on TV, on the radio, when people are talking about coronavirus. And having signed up to be a participant in the Moderna trial, I can also tell people my story. And I have to say, it changes minds. I actually was in a vaccination trial, coronavirus vaccine study. So we do have vaccinations.
So where can a person go to get?
Do you have a doctor? We are seeing Black people dying at higher rates of COVID-19. We're also seeing higher infection rates. And a lot of this is because Black people are more likely to be on the front lines, deemed essential workers, and unable to quarantine. Oh, so you want the vaccine?
Yes, ma'am. I'm ready, willing, and waiting.
Ready, willing, and waiting to go. All right, yes.
I mean, it's not unique to DC. I think we're seeing this story played out all over the country. Right now, what we're trying to do is make sure we have enough people signed up for vaccines to make it work.
Have 20.
So that's the problem.
Now, the dilemma we're in is that despite this disparity in health issues, they have multiple factors weighing against them to get the one intervention that could be life-saving for them. One, there's an entirely understandable hesitancy regarding a vaccine that is either developed by or facilitated by the federal government.
Yeah, I mean, I think our goal should be that if there's 105 seniors living there, we should try and get like at least 90 of them vaccinated.
I think that that coupled with, it's a new vaccine, I think, just the fear from African Americans and their experiences with healthcare in the past, and whether or not, they themselves experienced Tuskegee or those things that happened many years ago, I think that effect, is generational.
So we need to get at least 40 signed up to do it before we can come back. So we're gonna knock on people's doors.
If you have friends over 65, let them know.
You already got your shot? Okay. Okay, great.
I can prove it to you.
So we're not gonna knock on your door then. Hey, how's it going? We're doing the COVID vaccine next week here. So I just wanted to make sure that everyone has an opportunity.
So unless there's transparency and respect, and healthcare providers need to have a sense of humility also about the way we engage with the community and with our patients. So until we also look at our role, I think we will continue to see a lot of these health disparities.
Are you? Oh, you're.
No, I'm not taking that shot. I told I wasn't taking that shot.
Oh, is
I'm
there
not
any?
taking it.
Okay. Is there any information I can give you?
No.
You just definitely don't want it.
No, I don't.
Okay. All right.
Thank you so much.
Okay. Have a good day.
You do the thing.
I think, people still, experience kind of stigma and bias in emergency rooms when they seek treatment for care. And so I think it's just that sort of fear and mistrust is just going to be there. So it's not going to be any different with the COVID vaccine.
Are you concerned about the shot? Is that why you don't
I'm
like?
not concerned about none. I don't want none of the shots.
Okay.
I don't want none of the shots.
Okay.
I'm not taking no shots.
Okay, you don't have to take anything. We're just here because we wanted to give you the opportunity.
I don't want no shots.
Okay.
I ain't taking that.
Okay, there it is. All right.
Well, there are some people that are reluctant, and I was one of those that was reluctant about getting it. The reason is because of the different experiments that African Americans and people of color have had to go through the years. And my main concern was the fact that I don't think it's been long enough to know what the side effects are. You got mine? Because I ain't had it yet.
Yes.
You got my folder.
And often they say, well, we went too fast. You always tell us that it takes years to develop a vaccine.
We're going to start doing the vaccines tomorrow out in the community.
Why were you able to do it in less than a year, where you get the sequence in January and then 11 months later you have vaccine going into people's arms?
Yes.
They're actually they're really tiny. This is 10, that's 100 doses.
Holy moly.
And you explain that that is really a reflection of the extraordinary advances in science, the science of vaccine platform technology that took place a decade or more before we even began thinking about COVID-19. So it isn't as fast as you think.
I just don't want any doses wasted, okay?
Awesome.
All right, thank you all for doing that.
Yeah, I'm excited. Yeah, go smoothly.
So I want us to really change the narrative to talk about vaccine acceptance and how it's increasing. Because the more people see Black people or folks who look like them getting the vaccine, I am confident the rates will only increase.
After talking with a number of people, reassuring me of the safety of it, I just decided in the last few days that I would go ahead and get it.
You had a little bit of apprehension in the beginning. Do you have any questions for us now that you feel ready to go? Is there anything else we can answer?
I'm ready to go. You all have convinced me, and I trust you. So
Thank you.
I hope that the study had been longer.
Yeah.
Now I would have felt better.
That's the challenging thing with having something that is
So
new,
new.
But we need enough people to get vaccinated so that we can create that herd immunity.
Exactly.
So it's kind of a double-edged sword. You feel like
So
you
I'm
want to
like
be
in
among
the
the first.
experimental stage. See, that's the way I'm looking at it.
The good thing is that so many people have gotten it by now that I think we've seen the majority of things we're going to see. You know.
Right. Okay.
That's what Dr. Fauci says.
Yeah.
Yeah, this is like I trust Dr. Fauci.
Yeah.
Okay.
All right. So I am.
But there are other obstacles, and that is accessibility. So let's say somebody decides they want to get vaccinated. If you look again at the statistics, given the population of African Americans demographically represented and the relative proportion who've gotten vaccinated to compare whites to blacks, it's way out of proportion. They're underrepresented.
All done.
That was very gentle.
All done.
My word. I'm surprised.
Well, I'm an expert.
You could hardly feel the prick.
And the way around that is what the current administration has been trying to do. One, to establish community vaccine centers to make sure that they're positioned in a place, not exclusively, but clearly in areas that are demographically representative of the African American community. And then to get mobile units to go out into the community to make sure that not easily accessible areas are covered by vaccine implementation.
So the issue that we're having is that people don't really have like a time block. They're just all here, so we're just gonna have them, you know, like put 8 per hour type of thing, but we'll get to everybody, that's for sure.
When you live in an underserved community, you're poor, maybe you don't have transportation, there are already a lot of barriers to accessing services or even care.
It's a small step.
But if we really want to reduce these disparities, we have to eliminate as many barriers as possible.
There you go.
Your vaccination card, on the one side it'll have today's date, and then the other side will tell you in 4 weeks when to come back.
And deploying these services into the community, I think, is a really powerful way and impactful way to do that.
I said, how many have we done? 5 or 6? It's okay, it's the first day.
Hey. So one of the interns has called me and she's concerned that she's been exposed to COVID from a patient today. She said that they were doing breathing treatments and CPAP on the patient. She did have her N95 and gloves on, but she didn't have her eye protection on. At the very beginning of COVID, everyone was scared because we didn't know what was going on. We were concerned that we didn't have the appropriate PPE, the personal protective equipment that we needed, and there were just a lot of unknowns. And we didn't know if we were going to get sick, and if we got sick, what that was going to do to us or our family. So, I mean, it was scary. So it says this patient's unconscious, and I don't have any ALS to send, which means I don't have any paramedics to send. So we're going to go over there and see how bad the patient is, and we'll have to provide care if we need to. And then everyone thought we were getting better, and then this Delta wave hit, and it's just been terrible ever since. For this last wave so far of the coronavirus, it has just been worse than it was before. We've seen a lot more patients, whereas at the beginning we did have an X amount of patients, but they weren't sick like they are now. We're seeing multiple people with the COVID pneumonia. We're seeing lots of people that have actually gone to the emergency room or to their doctor. They've tested positive and or they've been diagnosed with the pneumonia. A day or two later, they're just struggling to breathe. And we're having to either intubate them or do CPAP or do other procedures on them to try to get them stabilized, to get them to the hospital alive. While he's getting situated, we need an O2 tank, that way he can go into the hospital. We've also seen an uptick in the cardiac arrests that have also been COVID positive as well, where we didn't see as many of that as before in the first wave.
You ventilate him a little bit faster. I want to see if I can get that capnography to come down any.
We know that sometimes when we have to intubate someone in the field, they may or may not come off the ventilator once they get to the hospital. So it weighs heavily on us that we have to do that, thinking that they may not never wake up or they may perish while they're on the ventilator. Resuscitated arrests have to go to a cath lab, remember? I know. Fortunately, we kind of know what we're doing since we've already lived through it for this long. We're more skilled at being better protected, at using our critical thinking and knowing exactly what we're doing and how we're handling it.
Virginia Beach for EMS 1.
Go ahead. But the thing that we're having trouble with is handling the sheer amount of people that we're seeing on a daily basis. Yes, we're good. It's stressful. All of our volunteers, all of our career staff, they are working to the max. They are going to the hospital, dropping their patient off, and then having to leave just to go get another one. All right, look, we're going to get you on the stretch and get you over to the hospital, okay? And I'm not saying that it's just purely COVID that is affecting us. You know, we have the typical medical calls, the heart attacks, the strokes, the accidents. But with all the COVID cases on top of it, it's running us really, really thin. So,
Is there a medicine? Does he have a medicine list in here too?
morale is low, stress is high.
Do you know what medicines he takes?
As far as people's home lives, they're scared of taking it home. I'm scared of taking it home to my family. I haven't seen my family since 2019 at Christmas, and then the virus hit, so I've avoided them. My husband has also avoided his family, so we haven't seen our family in quite some time, and it's just stressful. I worry that I'm going to come home not knowing that I am infected, and he'll potentially become infected. We are both vaccinated, but it's still scary to know that we could still contract the virus, that it could still potentially have long-term effects.
He told me his head was killing him.
I believe it.
Frustrations are rather high. We're overrun, we're stressed out, we're overworked. We just need people to realize that they can help us by getting the vaccine, social distancing, and following proper mask guidance. It would help us tremendously. Hey, this is Randy with BGMS. Someone called requesting transport for room 109.
11:21 to return.
That heart rate has been on its way up.
That's actually the same.
She was
better
10.
than yesterday.
She was 105 consistently.
It's very easy to make an argument to intubate this woman. Those compelling argument to intubate this woman a week ago. It's just that. Look, if she gets on a vent, I don't know that her mortality is honestly any better than what her mortality is now.
I think everybody's in agreement, right? Almost 100% likelihood she will die from this. Yeah. So now it's just how to best support her and her family through it. And I guess we all, having gone through this for, close to 2 years, were hopeful that, the rollout of the vaccine was going to help end this pandemic. And locally, because of our local high vaccination rates, and we're fortunate to be in the Metro DC, Maryland area where vaccination rates are high, we felt the benefits of that, and we went down to 0 COVID patients. But I think our window is closing. Although we knew deep down that it probably wasn't going to last forever. When that first patient came into the ICU and needed to be intubated in the vaccine era, it was like a gut punch for all of us.
When you do everything you can to not put them on a ventilator and then they go on a ventilator, oh man, the proportion of those people that survive this disease is extraordinarily low.
And what usually is a kind of lively hustle and bustle to get a patient intubated and stabilized was more of a quiet, solemn ceremony. And having gone through something like that the first and second time, you never want to go through anything like that. And I think that's what's important for people to realize is the toll that it's taking on society for sure, but the disproportionate toll it's taking on the healthcare providers in the hospital. The vaccination, all modalities of the vaccine are our way out of this. You went to see somebody.
Yeah, they were hypotensive, give them fluids.
Okay, not us, no. That having been said, we understand people's choices, but the choices have to be based on data and science and reality. And I think that's the frustration that healthcare providers are having right now, is seeing suffering when it doesn't have to be. Hi, remember me? You're looking more tired. You know the safest thing for you now is to be put to sleep and put on the ventilator. When faced with the sensation of air hunger and potential death, it's natural for the mind to go to the what ifs. And the obvious first what if is, what if I got the vaccine? What if I didn't have to think about leaving my son or daughter or wife or husband to fend for themselves? And that's the reality that we all see. And it's easy to have opinions about something until you've seen that and seen that in people's faces. I know you don't want the ventilator, but I mean, what if it was ventilator or death? If it meant saving your life, would you want the ventilator? I think this has to get back to being what it is, and that's a health crisis. It's not about anything more than that. It's not about who you are, or where you're from, or what you believe in, or what you don't believe in. This is a health crisis, and there's ways to deal with it. When you look at it for what it is, the only thing left to do is come together and defeat it. I think that's what's tough about this, is so many lessons learned, yet we're in the same spot. All the experience, all the surges, it doesn't even matter at this point. It's just, we're in the same spot. That heart rate is
Okay. Let's see, who gets to start? Ramon.
I think this was a strong portfolio. I think that these are some difficult topics to report on, and I'm not sure who the journalist is. The person who produced the video stories did a good job sticking with each of the stories and getting into the details and the nuance. If I had a note for the body of work, it would be that to maybe look for a way to make the stories a bit more evergreen. They're all very timely. I'm not sure what the timeline or the deadline for producing each of the stories was, but if there's a way to make the story last beyond just that moment in time, I think that would make the body of work a lot stronger. But otherwise, I think that they did a good job.
Just echoing a few sentiments from yesterday when we watched a few of these, found that they were able to get a lot of trust built in a short period of time, like especially the physician piece where he's talking to the patients, making choices right in front of the camera. I thought that was something I hadn't seen a lot of, especially early on in the pandemic when these came out. So I think that this journalist is able to build a lot of trust very quickly, get good access, and turn these around. I liked the Great Resignation piece as well. A lot of great interviews there, people being very honest about why they might stay home versus go back to work, which is not easy to get people to talk about. So a strong portfolio, I think, especially, I think they should place based on the work here.
I would echo a lot of that. I think it's a strong portfolio, a very talented journalist who, I think journalistically, all these stories were really very strong. They had a lot of nuance. It was clear a lot of reporting went into doing these pieces in terms of getting access to the locations and making sure, doing these narrator-less pieces are difficult. So really trying to make sure that you get all of the information out of the folks that you're interviewing is challenging. And I thought this journalist did a really, really good job doing that so that we were able to get context and scene together. I agree. It's clear that getting access to kind of places that people might not be able to see otherwise is a skill that this person has. I thought the shooting in several cases was very intimate, especially inside the hospitals. Those are hard environments to work in. I imagine they were wearing PPE themselves as well. So just a note on that. Overall, I thought it was a strong body of work. If I had one note, I would probably say for some of the pieces, the Black vaccines piece and the Great Resignation, less is more. Probably I felt a little bit like there was maybe too much crammed in there, and like, you know, I would have watched an entire piece with them door knocking in that one apartment building and hearing from people as well. But overall, really strong body of work.
I'll just add, I agree with all of this. I thought that they were great pieces. I am impressed that it was an individual portfolio, that this person did both the production and the editing. It's strong across the board. And as I said yesterday, I thought the edit on the doctor wondering why it had to be that way, that like the edit with the sound ups on that piece was pretty creative for like a pretty quick turn news piece.
So does everyone agree that this would get first place in the video, the portfolio video individual category?